Yeah. Hey. All right. Hey. Yeah, I mean.
So we about to take off.
Hey. Please do remain calm. About to run against spitting with a little bit of soul, no times.
Welcome to Please Remain Calm. I'm Ben Gonzalez.
And I am Daniel Gonzalez. As always, folks, the opinions expressed here on the Please Remain Calm podcast are our own. They do not reflect the opinions of the Los Angeles City Fire Department or the Los Angeles County Department of Health Services or anything to do with UCLA.
Actually, she's a DHS employee too.
Okay,
or former.
Just,
Sorry.
The point is, these are all our own opinions. Okay,
Exactly.
So don't go calling our bosses if we piss you off.
Don't snitch.
Listen, I also want to talk about our new sponsor. We introduced you guys to our new sponsor, CBD Living Water, last week in our last episode. And, you know, it's just like I said before, guys, I love water. It's literally all I drink. I've trained my children to only drink water as well. Like my whole life, I haven't liked fruit juices, sodas, nothing. Water has been my jam. So when we got approached by CBD Living to partner up and talk about their water and use their water, I jumped at the opportunity. We both did. And look, man, this job, firefighting, is extremely physically demanding. I would say that we're pretty much close to being professional athletes when it comes down to it. Physical fitness is important. It's a job requirement. You have to be ready to go from 0 to 100 in a matter of seconds. And when you do that, you sweat, you lose electrolytes. I walk around with a bottle of water in my bag on the rig all day long. I'm constantly drinking water to try to replenish and stay hydrated. And, you know, when you go to the store, there's a ton of options that you can get. And as you read up on water and stuff like that, alkaline water is really good for you. This CBD water is alkaline. It activates your CB1 and CB2 receptors, which essentially boost your immune system and keep you hydrated throughout the day. Mm-hmm. So give it a shot, guys. Look them up, CBD Living Water. CBD Living is actually a great CBD company. They have a lot of different products. Go and check them out. I'm going to be talking about a few of their other products that I use on a daily basis at the station as well coming up. But for now, check out their water, guys, and give them a shot.
Thank you. I just had some, just activated my CBD 1 and 2 receptors.
About to activate mine right now.
And look through. Still clear. You don't see any CBD balls floating around there. Why? Because they use Nano Technology, you guys.
It's Nano.
They have, shrunk the CBD balls?
Yeah, you can't even see them, man.
The first run of CBD Living Water looked like boba.
Yep.
Floating around.
Dude, I had a sore throat. And I'm not saying they did it, but I had a sore throat a couple days ago. Drank a bottle of this and it went away. So
CBD
I don't know, guys.
is CB believe.
I don't know what they're doing here, but they're doing something right. CBD Living Water, guys. Give them a shot. Try them. I've been drinking them like crazy, and I feel great.
Tell them your boys sent you.
PRC Pod.
You know it.
All right.
All right. We have a guest, you guys.
You're
Let's
welcome.
introduce her. Mm-hmm.
Good.
All right. I'm going to say that we have the smartest person we ever had on our show, probably.
Okay.
When we launched this show, I envisioned it as being a part of the academic discussion.
Oh, yeah.
You know
yeah.
I mean? I figured we have a lot of PhDs.
Oh, yeah.
You know
I figured
authors,
we're both academics,
lecturers,
right? Huge brains.
It was basically meant to be like TED Talks in an ambulance.
Yeah, exactly.
All right. Maybe we diverged from the path a little bit, but now we're getting back to our roots, our original vision, you guys. We have epidemiologist Chelsea Shover, PhD. Welcome.
Hey, thanks for having me.
Yeah.
Thanks for coming. I think this is the first person that has graduated from Harvard that was on our show.
Yeah, the boys will be really excited because we watch Big Bang Theory all the time. So when they tell me I have a PhD on, they're probably going to flip out.
Oh, that's great.
Yeah, that's cool. So thanks for coming on. You are the first epidemiologist that we've had on the show also. So maybe we can just start by explaining what an epidemiologist is and does.
For sure. Yeah. So a lot of people think it's about skin because of epidermis.
Yeah.
It's not.
Wow.
It's about epidemics. So it's basically studying disease and what prevents disease at a population level. So like I tell people sometimes someone will come up and ask like, oh, can you look at my rash? And I'm like, well, not really. I can't help you.
Yeah.
But
I got this mole.
if your whole apartment has a rash,
Right,
then call me.
Is there a rash outbreak in your building?
Yeah. Your whole building.
Your whole building. Yeah. So that's
talk to your
that's what we do.
neighbors.
Yeah.
Check on their skin.
How do you get to epidemiology? Like when you first started your schooling, did you think this is what I want to get into? This is why I'm getting into this, or
No. No, so I went to I grew up in Pennsylvania, a pretty rural town, like 1,900 people.
Oh, wow.
Yeah, I mean, no businesses. Well, actually, no, there was one campground and they were open like one day a week.
Wait, that was the only business?
Yes. And then when I was in high school, well, actually there was a bar, but then it burned down. So then there was, just the campground.
The campground. No.
Must have been a hell of a bar.
Not in this town.
Yeah, not in this town. Yeah. I was out of town when it happened. But I remember coming home and being like,
They
all
really
right,
burned it down.
half the business is gone.
Yeah.
So anyway, so I, and I went to high school in like a real town. But I was always interested. I mean, I was good at school. But I really liked writing, and I thought I wanted to be pre-med because I was like, well, what do you do if you like school? You become a doctor or a lawyer. I don't care about lawyering, so I guess I'll be a doctor. And then I got into Harvard for school, which was a huge surprise. Like, my family, my parents did go to college, but like my dad sells ski equipment. My mom's a first grade teacher. Like, it's not, I didn't know
You weren't a legacy.
No.
Yeah.
No.
There's no Shover wing of Harvard.
No, but I mean, I definitely had a ton of advantages and like also was just like really driven to like, I mean, frankly, like get out of the situation I was in. I was just pretty bored by
one campsite town.
Yeah, exactly. Right.
That's
right.
a huge-
I had no friends.
That's a huge motivator for people, man.
Yeah. Half the businesses in town were destroyed by that bar.
You could have either been an epidemiologist or a songwriter, a bitchin' songwriter.
Yeah. So anyway, I went to Harvard. I took one pre-med class my first semester, and I actually, until I applied to grad school, like years later, I thought it was a biology class. It wasn't. It was a chemistry class, and that kind of reflects like how confused about it I was.
Yeah.
So yeah, but I got really into journalism, and I did a lot of student journalism there, and like just really got into that. And then when I was graduating, I had taken a stats class like in my last year of school. I'd like taken Chinese because I failed my Spanish test for placement, and then I was like, I guess I should learn a new language, and like worked in China in like journalism stuff a little bit, and also in Hong Kong, and like that was great. And I graduated, couldn't get a job in journalism. I'm just like, I didn't have kind of the right drive and like self-promoting to like make that happen.
Yeah, it's like a different world.
Yeah. So I got some like random jobs in like tech and education. I ended up moving to New Zealand for a year and a half on a work visa there, working for newspapers there, and actually became like a newspaper editor. But on the way, like before I went to New Zealand, I got hit by a car while I was biking because I had this job as like a bike courier. It was actually a public health job, but I didn't think of it that way because we were putting bacteria in the storm drains to stop mosquitoes from breeding.
Yeah.
Oh yeah.
But I was just like, I just want to make $12 an hour and like ride my bike all day.
Yeah.
And that's anyway, yeah. So I had a concussion. It was pretty bad, and so then I moved to New Zealand and became
that's part of our bread and butter
Yeah,
wheelhouse of this show.
Let's pause on there for a minute.
Yeah.
Let's just hover over that for a second.
First of all,
Where was
people getting $12 an hour is what's keeping us from mosquito plague.
Oh yeah.
It's probably
You know
more.
what I'm saying?
Yeah, it's either
Pretty wild when you think about it, right? Here,
Yeah.
just drop this in the gutters, please, so we don't all die. Yeah.
Yeah.
I mean, that has a lot to do with we're talking about epidemiology, like spreading disease and stuff like that. Vector control stuff has a lot to do with
it.
it. Yeah.
And I, at the time I was just like, I'm a recent grad. I don't know what to do with my English degree.
Sure.
I live in San Francisco. I'm going to ride my bike.
So this happened in
San
Frisco.
Francisco. Yeah.
San Francisco's a dangerous place to ride your bike around. Feels like busy
It's a weird
spot.
place to drive in general.
Yeah.
Some streets in San Francisco, like you look at the lanes, like where the hell?
Yeah.
Like it's crazy. Like,
we had a guest that got run over by a train in Frisco.
Wow.
by one of the Muni
Trapped
cars,
underneath the train. But so what happened? You were just riding along and car just took you out?
Basically, I was like in a bike lane and the car in front of me merged, and I technically hit the car, but I knocked out, woke up on the sidewalk talking probably to a paramedic.
It's kind of funny when that happens, just a kind of side note on that, because an autoped, right?
Yeah.
A car hitting a pedestrian or someone on a bicycle is automatic trauma. Trauma center criteria. You're going to UCLA, full trauma, full boat trauma. But if you run into a car, that's not a full trauma, right? So a lot of times we'll get a call for like an autoped or an auto bike, right? And then you show up and there's someone with a bent up bike, and the car's got a dent in it, and you're trying to get the story, and the bike rider saying, "Oh, the guy hit me," and the car saying, "Oh, the guy ran into me," and the medics will kind of hang on that detail for a little bit because it's going to determine whether or not I have
what
to
you
take
have
you to
to
a
do.
trauma center
Yeah.
or not, right?
Yeah.
Because you could be not that injured from running your bike. You might have bonked your head or something, or
Yeah.
you know what I mean? You got a
Tooth
little bump on
busted.
your head,
Yeah.
but you don't really need to go to a trauma center.
Yeah, compared to being hit
But it's
by a
funny, you'll hear
car.
guys be like, "Okay, but hold on. Did you run into the side of the car or did the car turn and hit you?" You know what I mean? That sort of stuff.
It's a specific list that's trauma criteria, right? And like when you work a MAC, like you become acutely aware of that list because everybody calls, all these ERs will call my work to try to get patients transferred into a trauma center, and they say everything is a trauma.
Yeah.
This guy's hit by a car, and like you'll ask, well, you know, did the airbags go off?
Yeah,
did he
yeah.
roll over? When did it happen?
Even like rollovers, there's specifics. You have to have passenger space intrusion. There has to be certain things criteria that are meant to make it an actual trauma.
Yeah.
I also think it's interesting how like the littlest, tiniest things in your life might take you in a completely different direction.
Absolutely.
You know?
Yeah. So basically, like, I woke up on the sidewalk. I did get knocked out. I woke up on the sidewalk, and I didn't realize I was talking to a police officer, which I was just confused about the whole thing.
Yeah.
And later, I had to get a police report because I was trying to like get my health insurance stuff because I was like on a weird out of state plan, high deductible sort of thing.
Of course.
And yeah, it was like, you know, Shover gave a statement to the police. I don't know what happened. I just woke up here, and I was I guess that was my official statement.
And it's funny. It's something to keep in mind too for the paramedics and EMTs listening out there. Sometimes when somebody seems like they're a little off, you know, it could be because they bonked their head. You know what I mean? Especially working in a place like Venice or Skid Row or something like that, you'll meet people. Everybody's a little bit off.
That's their baseline,
right?
Yeah.
Everybody's off. Everybody's high, or everybody's on drugs, or mental illness, or whatever, different disease processes. So you'll meet people who had an accident or something, and they're a little bit off, and you're like, "Golly, man, is this because he bonked his head, or is this because he's high, or is this because he's just crazy?" You're just like trying to play detective and figure out what the hell's wrong.
Crazy.
Yeah, for sure. And I mean, it was interesting because I did get taken to SF General, which my understanding was that was for, you know, trauma and stuff. But I like woke up and became alert after that and was a little bit like aggressive. But I also at the time had like kind of a punk haircut and like a, you know, self-made DIY badge jacket. And like, I think they just thought I was just like an angry person because I was just like, I want to go home. Like, let me go home. Just let me go home. And they were like, okay, well, only if you have a ride. And I was like, oh yeah, I definitely have a ride. I'm definitely not going to bike 10 miles home right now. And I totally did because I was just like, you know, not in right mind. And then of course, like, you know, a few days later, it was like, oh wow, like I can't do things with, like I can't read normally. Like I can't handle 2 sound inputs. And so like that post-concussive stuff lasted for like almost a year till it was like totally normal. Yeah, I mean, part of it, I was like pushing it, and I was like, oh, I can definitely do like sports where I hit my head again. I mean, I was like, not.
You got to be
my
careful with that
frontal lobe
stuff.
was not fully developed, and I had a concussion. But like, yeah.
Were you seeing a neurologist or anything?
I did see one in New Zealand.
Yeah. How'd you wind up in New Zealand? I know you probably already said it.
Yeah. No, I mean,
Concussed.
Next thing I know, I'm in New Zealand.
Hey,
I got a shrimp on the Barbie.
Mate.
I'm living with the kangaroo.
Yeah, I had already been planning to go before that, and it was like I had a job at a tech startup, which I was terrible. I was definitely going to be fired, but I quit. And I had met someone who I thought I might want to date who was doing a master's degree in New Zealand, and I was like, I can get a work visa. I'm under 30. I was like 22 or 23 at the time. I can get a work visa for a year and just go there.
Why not?
And it turns out it was very easy to get hired as a journalist in New Zealand because like the education is just really different. And so like the US education system, or at least like my experience of it, like emphasizes grammar a lot. And like that's just like not really a thing that's important. So they were just like, wow, like, well, also I mean the Harvard issue like also helped, right? They'd be like, oh my god, you went to Harvard, like you can do whatever you want. Like I had a radio show in New Zealand because they were just like, oh, you must like know what you're doing. And I'm like, no, I don't. So I had like 10 minutes of a radio show, and I like worked for a couple newspapers. I was an editor. But like all this time I like also had this like post-concussion thing going on, and then I was finally like, okay, I have to like actually take some time off and just like not work because it's clearly making it worse. And during that time was kind of when I was like, well, what do I really want to be doing long term? And it was like, you know, I kind of miss doing math, and like I like writing, but like I like writing more when I'm not like on the next day deadline.
Yeah.
And, you know, I've
Yeah.
always been interested in medical stuff, and maybe there's something I can do that doesn't involve like blood and customer service.
Yeah, that's pretty crazy.
So
I'm
and
sorry though, but I want to bring it back to your radio show.
Oh,
Like,
my
was
God.
it like news updates or like what were you?
Yeah, I actually just found a clip of it the other day because I'm going to a conference where I'm teaching a workshop on like why scientists ought to talk to reporters, because a lot of people are scared, and
Sure,
I'm like,
yeah.
well, I used to
Yeah.
be one. It's actually a good idea. Like I've had a good experience, and it was called Chelsea Shover, Your Canterbury Rover.
Wow.
It's
Yeah.
weekly regional news. It was only 10 minutes. It was like
Uh-huh.
10 minutes on Tuesday morning.
That was the area of New Zealand.
Yeah.
Yeah.
And they just let me talk about whatever I want. It was like very shitty This American Life. Like I didn't
Yeah.
know what I was doing.
Oh, so you could think of you could pick
Yeah,
a story.
they were just like, you have 10 minutes, do whatever you want. And I was like, I just got here. I have a
Yeah.
tape recorder, but I don't know how to use it. Like
Yeah.
the first interview, they were like, it
You were
sounds
like Andy Rooney, 60 Minutes.
yeah, they were like, it sounds like you're recording this in a toilet bowl. Like, what is this story even about? And I was like,
That's
you know,
great.
so
And
yeah.
now your moment is zen.
they're like,
Yeah.
come on, Harvard.
Yeah. So
Get your shit together.
And also, like, there's just no grammar in New Zealand. Like, you
Yeah.
pick up the New Zealand Times, it just looks like my kid wrote it.
Yeah.
It's hilarious.
Gonna be sunny today.
Probably. That's hilarious. Yeah.
So how do you go from so you were there in New Zealand when your thoughts started going more toward like an epidemiology kind of route?
yeah, well, I was thinking I would go back to medical school. I was like, maybe I'll just try pre-med again. And then I had a job. I got a job in Irvine and moved back to California. Again, this was with, my partner at the time got work here, and I was like, oh, I'll just find something. So I had a job in Irvine that was at a medical school. And I kind of, I got there thinking maybe I'll spend a few years here and take courses. And then it just like, it happened that an opportunity arose for me to take the GRE like right away. And I was like, oh, I'll just apply now. Like, why not?
Okay.
Being a administrator for a gastroenterology department is like not what I want to do.
Yeah.
Being a reporter was like not quite what I want to do. It's like either I'm bad at work or like I need to find what I do like.
Yeah.
So I kind of applied sort of on a whim. Not a whim, but like I didn't put a lot of pre-thought into picking epidemiology. I
Okay.
applied to like 4 programs. I did not get back into Harvard. I did not get into Berkeley. I got into UC Irvine, UCLA. And the opportunity at UCLA was great because it was like, hey, like come up here, like you can easily get involved in like community-based research and like
Yeah.
also like we'll pay for your education. I was like,
Mhm.
great, sold. I'm moving to LA. Like
Yeah, yeah.
awesome. And yeah, so that's how I got into the program. And then once I had decided to do it, I did a lot more research and was like, oh, this is actually like perfect for what I like doing and
Yeah.
all that.
Yeah.
So
Yeah, it's so funny to me how people kind of roundabout get to what they were meant to do and what
Yeah.
they really
Yeah,
enjoy
'cause you
doing.
didn't set out for it, but then you found that it like worked for your style.
yeah, for
Yeah.
sure.
And it's funny because, and I try to tell my kids this all the time, and they're little, man, they're 11 and 9, but sometimes when things don't go your way or they don't go exactly as they plan, that's not something that's worth like losing your head over, or stressing yourself out
Mhm.
over, that the whole it is what it is kind of mentality that I've developed over my life, through all the ups and downs that I've had. It's like I've realized that even the downs have to a certain degree made me a better person, taught me lessons that I wouldn't learn if I hadn't been down there, classes that I took, taught me that ain't the life I want to live or whatever,
Mhm.
you know what I mean? The negatives, you learn just as much from your negatives and your losses and things like that as you do from your wins. And you never know where life's going to take you. Like something will happen and I'll be like, God damn, how did I get to that? And I'll look back and like, shit, if this hadn't happened or I hadn't, decided not to do this or not to, whatever, I wouldn't have gotten to this point. It's so
Yeah.
crazy how that happens,
Took her to freaking New Zealand.
Well, yeah, just
How
don't be
bizarre.
afraid. Don't be afraid of opportunities. It's kind of like my point. Like when a door opens up and you get that feeling like, damn, that might be something that I should do. Don't be afraid to take that opportunity and walk through that door. You never know where it's going to take you or what turns life is going to make that might make your life even better or might put you in a position where you're doing something you actually love, instead of being stuck doing something that you kind of like,
It helped Chelsea wind up actually at a place where you wound up, Skid Row.
Yeah.
Yeah. So I'll just like fast forward just in case anyone's like, oh my God, how do I become an epidemiologist? So like, generally in the pandemic, the rules are a little different because there's so much of a staffing need that like people will be a little more relaxed about what credential you really need.
Mhm.
But generally, it's like you go get a master's degree, like an MPH or a Master of Science.
Yeah.
Or if you're like me and you're just like, I just want to be in charge of whatever I'm doing. Like I don't care as much about what I'm doing as that I'm running it.
Yeah.
And so I got a PhD and yeah, so that's, you know, for me, mine took 4 years. UCLA's program is particularly efficient. Like if you just want to get a degree, get done and get out, like that's very possible. So like I worked at the LA LGBT Center, which is a big federally qualified health center in Hollywood. And I worked there throughout my PhD. And so like all my research I was doing for my degree was like things that would improve practice at the clinic.
Okay.
So I was like, okay, I'm working here 20 hours a week. And like anything I'm doing is like learning about how to do HIV prevention better or like treating gonorrhea or, you know, and then I got into like substance use stuff through that kind of, and, you know, plenty of like personal experiences or family experiences, but like that was kind of the route. So yeah, so I did that. Then I did a postdoc because I knew I wanted to, at some point I figured out I wanted to be in academia. Yeah, I did a postdoc, did a stint at the county early in the pandemic.
Postdoc is like postdoctorate.
Yeah, postdoc is in like a job where you are paid well below market value for your degree in order to train more.
Okay.
Yeah.
Yeah.
Like it's like an internship, honestly, but it's a full-time job.
Yeah.
But
Yeah.
Right.
So I did that at Stanford. It was really cool, a lot of policy. Then the pandemic started and I was like, I really, you know, as an epidemiologist, like one, I'm on the job market trying to get hired by universities and everyone's frozen. So like I had interviewed at UCLA and that was my top choice to come back and like and you know, this was in the med school. But those all froze. And then a friend of mine was at LA County and was like, we need epidemiologists. And I said, I don't know how long I can give you. It might only be 6 months. It might be a year.
Yeah.
They're like, yeah, that's cool. Like just come and, you know, for that. So I was an employee of DPH, like a contractor. I was never actually an employee of DHS, but I did end up working a ton with DHS on COVID vaccine stuff. So like my job at DPH was running the team that oversaw outbreaks in homeless shelters and encampments around the county.
Okay.
And then that grew into this vaccine project, which, you know, a lot of it was in Skid Row.
It was pretty amazing early on in the pandemic that it didn't seem like the homeless were getting it.
Yeah.
You know what I mean? You know, obviously Venice is the second highest homeless population in the city of LA, Skid Row being the first. But, you know, I mentioned earlier that I worked Skid Row for a number of years earlier in my career, and I know guys that worked down there, and it just didn't seem like, I know our homeless we weren't running on the homeless for COVID. You know, it was all the same basic stuff that we were running on ODs and fights and stuff like that.
Yeah.
But even when we were getting COVID calls like all day, every day, it wasn't with the homeless, which we were all kind of tripping out on that. Did you guys notice that in your...
Yeah, so basically, some of it is like, honestly, I have this analysis that like I've been trying to do, I've been failing to finish for like at this point 2 years about outbreaks in shelters versus encampments. So basically I think like the summary for LA is most of the people experiencing homelessness in LA are unsheltered, which means they live like outside of vehicles, stuff like that.
Right.
Shelters, super high risk for COVID and many other, you know, any other kind of like respiratory illness.
Oh, yeah.
Because it's congregate shelters where people don't have their own room.
Yeah.
Mm-hmm.
But in LA, because it's mostly people who aren't in that environment, that's, you know, being outside is protective for COVID.
With
But
the wind and the sunlight and everything.
Yeah.
Okay, that
But
makes sense.
what we found in our data, and like this is something that we presented at a conference, but like it's on me to finish publishing it. But you know, we found that like once there's an outbreak in an encampment, the number of other people who get it is pretty similar to a
really?
Shelter. But
Once
like
it's there.
Once it's there.
Yeah.
But it's just, you know.
Yeah, because those shelters, it's almost like you're swimming through it. The air is so thick in those dorm rooms of the shelters, right? Like if you get shortness of breath in the dorm at the midnight shelter, midnight mission. We used to call it the stinky foot room, right? Because you take the elevator up to the hallway and it's like, all right,
Yeah, the
And you
smell.
go in
Yeah.
and it's literally like you
Yeah.
could feel the thick heat of just the air and
The
the
funk,
feet and
yeah.
the funk, that's
Mhm.
in there. And so we'd go in and like, hey, you want to go to the hospital? Yeah, come on, let's
Let's
go.
go, get
And
out
you
of
get the
here.
guy and get out. But I can imagine if you have, somebody that has COVID in there, that is a perfect environment for it to just sit and
Ugh.
breed and spread
Yeah.
and stuff like that in those.
Big
Yeah.
armpit.
But yeah, we were all kind of tripping out when we were going through it. Like, God, have you guys had a homeless COVID patient? No, we haven't had one. We haven't had one. It wasn't until a little bit later on in the pandemic where it seemed like it actually started running through.
Yeah.
Yeah. Yeah. And
downtown
it's been,
and Venice.
and I think the other important thing with that is like, once, like on average, like once an unhoused person gets COVID, they're more
Yeah.
likely to, compared to someone of the same age group, they're more
Sure.
likely to die. And like that's all the kind of comorbidity stuff we talk about.
Yeah.
But that was another thing that like we, did after I left DPH. It was like an analysis we did to kind of make the case like vaccines should be available to people experiencing homelessness, even if they're under 65.
Sure.
But that was also like a practical thing of like, because shorter life expectancy, if you go into a shelter and you're like, all right, who's over 65? Like, you're not going to get many people.
Yeah, that's
And
true.
you're already
Yeah.
there. Like, just vaccinate everybody.
Yeah,
But-
exactly.
so,
Yeah, it would be funny how like no one's over 65. Okay, see ya.
Yeah, see ya, we're out of here.
We're
We
outta
got
here.
the vaccine, but we're out of here.
Hey, the mayor could have stepped up and like ran on that, like homeless shelters. I'm trying to keep you guys safe.
Yeah.
You guys are better off out here in the streets.
well, so they kind of did.
Yeah.
Yeah, I don't think that was part of the public messaging, but that was the practice recommended by the CDC. Like, don't clear encampments if you can't get people into like a
Into
private
shelters, yeah.
room.
I mean, but
Yeah.
that's an ongoing problem over
Yes.
and above epidemiology or
Yeah,
COVID.
for sure,
you
for sure,
know.
for
Right.
sure. But yeah.
The unhoused situation in LA is crazy, and
Oh,
there's
yeah.
nothing. You can't kick the people or evict them from their spot on the sidewalk without having a shelter
Yeah,
for them, a shelter
exactly.
bed for them. So that's and then you go through and you get into going and actually talking and dealing with these people, and you realize that a lot of them are from out of state. That come to California because it's a better climate. They're nicer to the homeless here and stuff like that. So you get California dealing with a lot of the nation's
Everybody's
homeless that
homeless,
migrate
yeah.
over this way as well.
Mhm.
Oh yeah, we got a whole podcast episode
there's a
on
few
the
episodes
No,
unhoused
about
yeah,
too.
that.
yeah,
Yeah.
for sure,
Um,
for sure. Yeah.
Do you or the people you work with advise the county on their policy making when it comes to COVID?
Well, I don't now, but like when I was working for the county, I guess, yeah, like
Yeah.
we'd say, I mean, my role as a scientist is always like, this is what the data is, and here's what our best guess at what would happen, if you take
Sure.
this or that action. So
Yeah.
I mean, I definitely did that when I was there. Now, I mean, I still talk to people, I still write things, but not in any kind of official capacity.
Is it a fairly small community of epidemiologists? Do you guys share information pretty readily when it comes to stuff like that? Like,
I think so generally. I mean, the thing is like what's complicated about COVID specifically, it's interesting that like, I went into epidemiology thinking that for the rest of my life, I'm never going to have a global pandemic. I'm never
Yeah.
going to have a situation where everyone knows what an epidemiologist is. Yeah, I'm going to continue laying like,
Yeah.
no, it's not skin.
Just your luck.
Yeah. Yeah. But there's a lot of people involved in the kind of decision making, and epidemiology is just one piece. So
Yeah.
working with a lot of like docs, nurses, even just, I don't know, like other disaster services people. So
Sure.
I think, DPH has a huge epidemiology presence, and like that's all part of decision making. And then so like, but now as an academic, I'm kind of outside of that. It's more like it's actually really nice. Like I can be more independent because like I speak for myself. No one thinks I speak for UCLA, but I don't speak for UCLA. Like
Yeah.
so
Yeah, it's nice to have that independence, huh?
yeah. But I think it's a pretty, I mean, there's, I think it's a pretty collaborative group of people, and, we don't all agree. Like there's people like, I don't know, Twitter in a pandemic is kind of a mess, but
Yeah.
yeah.
Sure.
So, yeah.
Okay, so you guys recommend to the county that people experiencing homelessness should be vaccinated. So
Yeah.
they say, okay, fine. Here's the vaccines. Like, how did this work?
Yeah. So, I mean, I guess, to be clear, the county was always like, we are going to vaccinate. Like, that was always part of it.
You didn't
But,
have to
like,
twist their arm.
Yeah. But my thing was like, hey, look, like the mortality, even at younger ages, is higher. Like, I had a team of a couple students where we pulled all the public data from like 76 jurisdictions in the US, including LA. LA is like by far the best homeless COVID reporting that's public. Like, other jurisdictions do a good job, but it's not necessarily like as frequent as here.
Yeah.
And so we were able to say, here, look at the age adjusted rates on this weekly report that's like public, and you can just do the math from it. And so that, and a lot of like, I think, advocacy within the county about it, and like just sort of realizing, and I know the state did this too, and said like, okay, we're going to vaccinate all unhoused people, regardless of age, as long as they're old enough to be eligible. So it was funny. Early on in like January, I remember having a call with one of my clinical colleagues at the county who I was like, look, like I'm running this like weird volunteer program because there's a lot of places that got vaccine allocation, but they can't meet the state's data reporting requirements. So I'm just like finding them grad students to help, like even just sometimes just enter data. And I talked to a friend at in the county's vaccine program and was like, what do you need? And it was like, yeah, we need the data volunteers and stuff, like that's all helpful, but what we need right now is like people whose job it is to watch the cooler and make sure our cooler stays the right temperature.
Yeah.
And I was like, okay, do you care who these people are? Is it okay if I just like, is it sufficient for me to just vouch that like they're cool and they're going to show up and be reliable?
Yeah.
I was like, cause I don't have grad students, but I do have a bunch of musicians.
Yeah.
And so that's actually, so like cold chain volunteering like was kind of the first thing where I was like, okay, like, and I ended up, I drew in, my husband's a music producer. I drew on, he was definitely in on it. And like, we were getting a lot of his friends and they'd just go out like, with the county's team, and they'd be like, okay, you're cold chain guy. And like, you just make sure. And then after a while, like they showed that, okay, this cold cube method works to keep it the right temperature. They stopped needing to have like a separate person.
Somebody there,
Well, no. And like, it just became folded in with the job of someone else. Cause they were like, okay, you don't need to be watching it like 100% of the time.
Right.
Checking it once an hour is fine.
It was interesting how it seemed like they were working all that stuff out as we went along with the vaccine,
Yeah.
Because the fire department did a lot within the city of LA as far as like giving the vaccine, doing testing and stuff like that.
Yeah.
And so they had a lot of there was a ton of like inspectors and like special duty spots, guys that were getting overtime
the COVID detail.
Do just that, be one of the, be one of the cogs in the chain.
Absolutely. Yeah. I mean, I got my vaccine from LAFD like one of the first days because they announced for a DPH, like, okay, everybody has to work at the vaccine pods, even if, cause I had thought, I was like, well, I'm an office person. Like, I'm not going to get my vaccine until like end of the line, like May 2021. But then in January, they were like, oh, actually starting next week, you're all going to work at the vaccine distro centers. So
you got to.
Yeah. Well, no. And then, so I got it. And then it was like, okay, yeah. And then I was like, okay, well, it turns out I know all these grad students and stuff who want to help, and like just connecting them with all the different organizations that needed volunteers. And then we started a research project, which
with helping out with giving the vaccine and that entire project, do you guys monitor or keep track of like how it affected the spread? Like, did you see your outreach in vaccinating these different populations, different part of the city? Do you guys like monitor and watch whether the outbreaks decrease in that area or anything like that? Like, do you follow whether or not giving the vaccine in a certain area was effective to that degree? Does that make sense?
Yeah. I understand what you're asking. I personally don't. If the county did something like that, it was after I had already left. Okay. So I'm not totally sure. I think the one thing that's important to mention though, like really early on, as you probably know, like there was so much like vaccine tourism of like people driving to like a neighborhood that they've never been to. And, like getting vaccinated.
Oh, to get vaccinated?
Yeah.
So you have people showing up like to Skid Row? Like from outside? Like it was even happening there?
I mean, no, by the time I was working in Skid Row, that was not an issue. But like early on, well, actually, yeah. not really.
Get in the car, honey. We're
Yeah,
getting
come on.
shots.
Taking it
Yeah.
in.
You found
But
a
no,
clinic?
I mean, it was
I
it
found a
was
clinic.
like it was like a whole problem at like some of the clinics that I was sending a lot of students to was like, how do we get the word out to the immediate community, but not like have like, just be overrun by hipsters
Yeah.
who
Yeah.
like young, healthy hipsters. Like
Crazy.
it's, anyway.
So we're talking outreach for vaccines, right? But it was like literally, like, how did this work? Like you were having to just go up to, homeless people.
Yeah. Oh, so
essentially.
this is separate. Yeah. So
Yeah.
okay. So after like volunteer stuff, then there was an opportunity at UCLA to get grant funding to do something related to COVID and health equity. And I was like, okay, well, so I called up my clinical colleagues at the county and was like, there's this funding thing. I think we can write a grant together. Let's do it. What do you want to know? And, I know what I want to know. It's like, I saw, that friends of mine who were initially not sure if they were going to get the vaccine, but then I was like, well, hey, you don't have to get it. That's cool. But I need someone to watch this cold cube. Like, would you at least do that?
Yeah.
Because they're like, I get the vaccine is important. I'm not sure if I'm going to get it. And then, one day I watched in the cube and they're like, all right, put it in me.
Yeah,
Like,
right.
and like that sort of like getting people involved, like that was something that I was really interested in.
Yeah.
And so the county wanted to do a program that was recommended by the CDC of having vaccine ambassadors. The idea that like people from a community get vaccinated, like once they're vaccinated, they tell other people about it.
Right.
So, they ended up coming to me and, we talked about it and I was like, well, if we run it as a research project, that means that like we can do it where we're paying people as research participants. And it was my first study as a principal investigator, which just basically means that like anything that happens on the study, like, or to anyone participating in it is kind of on me.
Yeah.
And so like, it's just like a lot of responsibility.
Sure, yeah.
So our model was same day peer vaccine ambassadors. To my knowledge, we're the only ones who did this in encampments. A lot of places would like enroll someone where they'd train them for a long time. Our model was like, we go to the encampment, we talk to people, we find out who's vaccinated, and we're like, hey, we have this study. We'll pay you $25 an hour if you'll share your experience. You don't have to be like, you have to be vaccinated. We have to be able to show that you've already been vaccinated or you got it today. That's fine too. And then you can join us for 1 hour up to 4 hours. We'll pay you in gift cards. And you can say, I mean, we're not going to tell you what to say. It's just like, we just want you to share your experience.
Yeah.
And
like homeless vaccine influencers.
Exactly.
Basically.
Yes. And so we did that all over the county. I had a team of grad students, and then we eventually, like gradually, we trained the county's community health workers to do the research consent process, which is like pretty intense and like not usually how this goes. Like usually you don't have people who like have never done any kind of research and are maybe like actively like hostile or suspicious about it.
Yeah.
But like it ended up for me being like I had to win people over kind of one-on-one, like saying like, yes, like I'm aware of like many historical abuses by the research establishment. Like I know, and then, everyone had to watch the training, and like I got calls from some of the people that'd be like, yo, Chelsea, like I think you're an ethical person, but like I just learned a lot about Tuskegee, and I'd be like, this is for this training you made me do, and like
You're
I don't
apologizing
know.
for every research experiment in like the last 100 years.
I mean, pretty much. And I'd be like, yeah, like getting input from, I mean, it was awesome, but like, wow, that was a lot of relationship building. And then, we got to a point where it's like, okay, like everybody can recruit, but yeah, it's really just show up at a spot and who's there. That's our ambassador.
Yeah. And there's teams that do that for just like medical care and stuff too. That show, we get calls all the time to the encampments for an outreach team that came and was talking to someone that they've been following. He's usually up here in Hollywood, and we've been looking for him for the past 2 months. Now he's here, and he's got this going on, He's got a history, give him the whole history, and they got a little book on him. You know what I mean?
Like,
it's
like, this is helpful.
Yeah, and you're like, damn, this is helpful. And then you go to the guy, hey man, how you doing? And you're like, I'm fine. And you're like, damn it. But these people want me to take you to the hospital. What's going on? You've really got to kind of, and that's the other thing too, is like, just like I said, you're dealing with a lot of times with people that have mental health issues or drug issues and stuff like that. So even just getting basic information out of people sometimes, or getting them to share, these are also people who are really reluctant to open up to people, scared of new people, new experiences and stuff like that, because I mean, essentially you get treated like shit all day, every day as a homeless person, from normal people that walk up to you and nobody wants to look at you and stuff like that. So there's that barrier too that you have to get past with people. And then what do you do with all the information that you have afterwards? Like, do you take all that and
Yeah. So the first thing we do is we take it and give it to the county and say, look, like, here's our evidence that this works. So we found that, like, you know, for every hour that we paid what we were calling a peer ambassador, and that's just like a person who lived at the encampment or shelter. But I was really focused on the encampment piece because I think that's harder and like more important in LA. Well, just by number of population, right? And yeah, we take it to the county. We say, look, like, here's our graph. This works. Like, it would be good for you to pay for this.
Yeah.
And they did. And so, like, my study ended because the county took it over, which is 100% of what I want. Is like, I want to like do this like kind of pilot unusual thing that's like a little bit risky for me and risky for my staff too, because it's like everyone's going into the encampment environment and like, you know, safety is the most important thing, but like lots of stuff still happens.
Sure.
But yeah, and then the next thing we do is like, okay, well, like, now we'll write it up and we'll present it. Like, we presented at a conference in Seattle to other homeless healthcare providers, and like we've published like 2 papers on it. We're working on the 3rd one, and so like then it'll be in the academic press and make it available.
We shouldn't breeze over the fact too that these are really unstable places.
Yes.
These encampments.
Yeah. That's what I'm saying. And she's in there with a bag full of gift cards.
Well, yeah, and
oh yeah, so that's like. Yeah. So, right. So like for everyone, before anyone could like recruit people to study, it's like, so I have the obligations as a researcher, which is just like, you have to do this training that's like about research ethics. And then I said, okay, you have to watch this video or like attend a live training with me for an hour that's really focused on like more of that safety stuff, especially around carrying the gift cards. There's a maximum you can have. You can't ever have more than, you're not supposed to ever have more than $200 because that's the most you could pay out in one day. Like, we set it up that way to kind of minimize like that kind of situation. And then like I have to train you in the field. So then, and then of course I like train my students to like get to a point where they could certify. So we eventually had like, you know, the 8 county teams, which each have like 4 people. And so this was, you know, a lot of like in-person field time, but yeah, super unstable. I mean, that's kind of our message was like, you know, we know things are going to happen. We're not trying to prevent things from happening. I mean, we are, but like, we know that things are going to happen. We need to be ready to respond. And like, that's both like in the moment, like get yourself to safety, because part of your job is to keep it safe for the participant by not giving them an opportunity to hurt you.
Yeah.
Like, because you are dealing with people who have been really mistreated or are just dealing with other stuff. And it's like, a lot of times the best thing to do is get out of that situation. And so my staff, it was always like, you can leave for any reason. Just let me, as soon as you're safe, you have to let me know so I can tell the other people where you went.
Sure. Yeah.
And, you know, but then also like situational awareness, like crisis communication afterward.
Yeah.
So like anytime there'd be an incident, and there were many, even, you know, fairly small things, like I'd send a thing out to the team. And of course, if it was something like in the immediate area, we'd like do text, but usually it was like, oh, you know, this person was out today and like there was a weapon found at scene, or like this person, you know, someone threatened to shank them and like she got out of the situation, but she's on, I mean, I know you all talk about like light duty, like our equivalent of that was like, okay, like if you need a week to like just look at data, decompress, like come in the office, look at data, or just go on the shelter events after like the encampment environment. Like we would all say like, oh my gosh, the shelter events it's like going to the spa. Like,
well, there's some rules. There's some rules there. You know, I mean, there's a little bit of organization.
Take me to a homeless shelter, please.
Yes.
Well, it's almost like in the shelters, you have people that are okay with following some rules.
Yeah,
you know,
to be in
hey,
the
you can't have this certain stuff in your cubicle. You got to keep it this tidy. You got But a lot of people are homeless because they don't want to follow any rules. You know what I mean? Yeah. And so, you can really feel the difference in the from an encampment environment, just like she said, and a shelter. You know, the tiniest things can set some people off in the encampments too, and it's almost like a chain reaction. You get one person going, and the tent next to him gets going, and then this guy goes, "Hey, shut the fuck up! I'm trying to sleep, and fuck you, dude!" And shut you. And then it just kind of like spreads, you know. Just the other night, we have the fire station that I work at is right on Venice Boulevard, by Lincoln, and right in the center of Venice Boulevard, there's a public library, and Centennial Park is a small park in the center. Well, over the past 8 months or so, that park has been completely taken over. It's a huge encampment now, and people, they're always lighting warming fires or little fires to cook their food or something like that. And those are illegal fires. The neighbors call, we got to come and put it out.
Right.
And so when you go 3 nights in a row putting a guy's, dinner fire out, the other night, maybe a week and a half, 2 weeks ago, that guy got pissed off, started screaming, "You guys are always," and then his girl was screaming at us, and then they started throwing stuff at the truck, throwing stuff at the engine. Then they laid down in front of the engine, wouldn't let the engine leave when the truck took off. And so, even with us, with lights and sirens and, a badge and the sense of authority, you can still lose control over something like that. So when you have a group of researchers that are coming in, you know what I mean? Or do-gooders is what we call them. You can lose control very, very quickly.
Sure.
Those things. So when we talk about going out to an encampment and doing this sort of work, yeah, it's research, but there is a danger factor to it for sure.
For sure, yeah. And so and just to be totally clear, we were 100% always with the county's vaccine teams, which include community health workers who are like lots of people with their own lived experience of homelessness, including like sometimes currently, but they're working full time for the county.
Yeah.
But, and so that was something like my team of do-gooders never alone.
Yeah.
But still, still things happen.
You never know.
Yeah.
Is there, like obviously you can work for the CDC and like national organizations.
Yeah.
Is it scaled up? Like the state have their own epidemiologist jobs that you can have and stuff like that, and onward to a national level too?
Yes. Yeah. You got county. I mean, even some places have city, like City of Long Beach has their own health department, City of Pasadena. LA County. I mean, a lot of people who graduate from my program go to LA County. Some, end up at California Department of Public Health or CDC. And
so
WHO.
There's a lot of opportunity out there.
Yeah.
Especially right now, right?
Yes.
Yeah.
Yeah.
It's interesting too. You said, you're kind of interested in doing like trying new studies and doing things a little differently. And if that works out, then the county picks it up and takes it over. That's kind of like great for you. It feels like we're in like this funky transitional period for everything. You know what I mean? So it almost feels like now is the time to try new things or try new methods of outreach or try something different than we've always been doing. You know what I mean? Does that make sense?
Yeah, totally.
Like I get that sense in everything. Like we were talking in our last episode, we were talking about the fire department and how it's changed over even the past 15 years. We had an episode on gun control a couple back, and just, it's interesting to me how with the times things change, but right now in particular, the past couple of years with the pandemic and, everything with, red and blue, going at it politically and across the country, it feels like change is just like churning up. You know what I mean? So I don't know if do you get that sense at all? Like that it's easier now to try new things or try things from a different angle?
Kinda. Yeah, no, that's interesting. I mean, I'm so new at being able to run my own study that like this is the only thing I've ever done.
Sure.
But yeah, I mean, I think you're right. Like in the sense of, we know that homelessness is probably like the number one issue in LA, and like I'm really proud of the fact that we were able to find a way to like engage people where I didn't even get to talk about like how good the vaccine ambassadors were at my, it's not a revolutionary idea, but it's like just pay people to help you, right? Like, and make it very low barrier, because a lot of people, like you're saying, like they're not going to be able to, because of the other substances or mental health or just like trauma of living on the streets, they might not at this moment be able to say, yeah, I'm going to do a full-time job, but they might be able to work with me for an hour or two.
Right.
And then there were a couple examples of people who did this and then, ended up getting a full-time job because like the community health worker who worked with them, like, referred them somewhere. And then it's kind of so that's what I envision is kind of like this gradual, like, how do we look at the strengths that people have, living in these environments and like, really try to build on that and support people. And like, that's something I really wanted to be able to do, but didn't, because like basically it worked quickly enough that it was just like, okay, study part's over. Like now we just do it.
Now it's a program.
Now it's a program. Yeah. But like we didn't get to do like some of the long-term employment or housing stuff I wanted to, but oh my gosh. And the way, you talk about like the way people communicate, like that was another big like safety thing we had, which was like, how do you determine the difference between like disruptive and dangerous?
Yeah.
Like we enrolled some people who peer ambassadors who the way they'd get their friends vaccinated would be like by berating them.
Yeah.
And like, I can't
Yeah.
do that. But like, I remember very distinctly, like one woman like telling her friend, like, get out of my tent. Do not come back until you're vaccinated. You are contaminated. You are not welcome here. You know, that person got vaccinated. He actually later was an ambassador with me. And it was just very like, okay.
I remember I got yelled at. I was working at Nines on Skid Row.
Yeah.
And we had a new captain that transferred in. And you do develop, you do kind of get to learn how these people think and how their brains work and who's high, who's got mental illness. And so you kind of develop this, like, especially on Skid Row, like everybody's either mentally ill or high that you come up to on a call. And so you almost got to like, you develop this way of talking to people like, hey, buddy, you know, and then they realize you're actually human that's there. And like, oh yeah. And you're like, hey man, what's going on? You know, but it's almost like, hey buddy, if you're talking to them, they're over here and they're, you know, messing with this or whatever. You almost have to snap them out of that to get them to pay attention to you. Right. And so pulled up on an incident with this new captain. It's his first day and the guy walk up to the guy and he's, you know, doing this and hey, you know, kind of snapped at him and then we went through a little whatever assessment I could get out of him, got him in the hospital and get back to the station, get called to the front office. And I got a talking to for yelling at patients. And I'm like, Cap, and I, you know, Captain 2 is sitting right there and I go, vouch for me on this one. I go, Cap, you have to talk to people like that. Yeah. You know, there are certain people that I don't have to, but when I get on scene and I realize the type of person that I'm dealing with, I have to meet them on their level in order to get anything out of them. Man. And it's true. Like, and working with the homeless for a certain amount of time, you get a better gauge of who needs humor when you're talking to them, who needs to be a little bit put into place. Hey dude, relax, you know, relax. I get you, and be a little more authoritative for you. Who is on, you know, in another planet, and you kind of have to round about and talk to them about what they're talking about and mix in what you need them to do into their space talk or whatever it is they're talking about. Yeah. You develop this way to communicate with this community of people. And, you know, I've worked with homeless throughout my career for a number of years, 15 plus years. And so I understand that there are people out there that are out there because they 100% want to be, you know, they don't deal with authority well. They want to be on drugs all the time. They don't want to listen to anybody. They're in that position because they like to be. But there are a ton of people who had no choice. They were forced into that position. You know, disease processes, you know, that made them bankrupt. You know, truckers that came out here and their truck broke down and they didn't have it and they're just stuck with nothing and no job and stuff like that. So, programs like this that outreach a lot, you'll hear two sides of it. You'll hear people that are like, hey, these, you know, POS people, they don't want to take care of themselves. Screw them. Let them go be on the street, kick them out of my city and, you know, kick the can down the road to another town. But programs like this, I think, help our communities in general, not only the homeless, but you know, who knows who's not going to get COVID from the homeless guy that came up to them and asked them for money, or that they, you know, kindly out of their own heart gave $1 to or whatever. Yeah. Who knows, just like you said, who is going to get, go through and get vaccinated and be an ambassador for you and realize, oh shit, I can make a little bit of money doing this little bit of work. Let me get a little part-time job and, you know, might realize that this is a better life than that. Who knows? You might get 25% of them that improve their life somewhat. You know what I mean? But it only happens when somebody like you decides that this is a populace that we need to pay a little bit more attention to and extend a handout to. Extend a hand out to, not a handout.
Yeah, absolutely. No, I mean, that's what something that was like fun, like interesting to me was sort of seeing, we ended up like on the front page of the LA Times, and like we got like a lot of attention for this because it was, you know, and I think it appealed to a lot of people who traditionally maybe were more on the side of like, well, like I'm not going to be helping because they're like, oh, well, like people are working for the money. It's like, okay, like if that's what it takes, like great. Like I think it's good just because it's like, it's obviously effective. It's cost effective. You shouldn't need to show something's cost effective, but you kind of do to have it work. Sure. But yeah, for sure. And like, oh my gosh, just, the number of people that you could see, like the confidence, and also importantly, the number of people who were already trying to get their neighbors or community vaccinated, who like, I'd say, oh, well, like, we're doing this program. They're like, oh, I don't know if I'll be any good at it. And I was like, oh, well, why? And it's like, well, I've been working on trying to get my neighbor to get vaccinated for the last like few weeks. And like, they're not doing it. And I'm like, no, that's cool. Like, you will be great. And then they would be. And we'd count the number of people who they referred in and stuff. And
you don't realize, and I tell this to like young guys that I work with too, like, can you imagine being homeless and being filthy and having your beard grow out and stuff because you don't have the means to be able to clean yourself every day or whatever, right? And everybody just looks at you like you're a POS, right? Everybody kind of, shies away from you, doesn't want to be near you and stuff like that. That has an effect on your psyche, And so for somebody to come up and give a person like that who really doesn't have anything, doesn't have any like, cool relationships, like everybody just kind of looks at them like they're a POS, and you give them something to hold on to, some sort of meaning or purpose. Just that little tiny spark of purpose in somebody who has none could be the spark that gets somebody motivated to better their life a little tiny bit. You know what I mean?
Yeah. And Chelsea had a chance to do that over and over and really make a difference in the city with people who needed it.
Absolutely.
And like when you were looking for like what you wanted to do and you weren't sure about going into this field or anything, this wound up being like a really like satisfying project for you, for it being your first project, because you got to make a difference and you saw a change in the people that you were working with and giving opportunities to.
Absolutely. Yeah. I mean, this was my first field study, and I mean, it's cool. And I think the other thing that was really always part of it and kind of the model for it is like, I come from a background of doing mostly like addiction and overdose research. And like when I was at the county, I remember one thing they were asking, like what you mentioned about like, oh, like, folks living in encampments aren't really getting COVID. But like I remember getting questions from press at the time, because I was a supervising epidemiologist, that was like, are you undercounting deaths? Like we're seeing a lot of homeless deaths. Why is your number so low for COVID? And I'm like addiction researcher. So I was like, well, I bet it's fentanyl. Like it's 2020. Fentanyl is here.
Yeah.
It's been here. I mean, the first person I know who died from accidental fentanyl overdose was in 2018 in LA. I mean, a coworker who thought it was cocaine. And it was like, he and two of his friends, all passed away in downtown. And it was like, I thought that was going to explode here. It has now. It took a little longer than I thought, but it was like, I bet
it's all over the place now.
Exactly. Yeah. No, now it's so that's kind of what what I had thought is like, oh, in a perfect world, there wouldn't, well, I mean, ideally what I'd be working on would be around doing this like peer kind of model related to overdose prevention.
Yeah.
And so like now I'm kind of more back in that space again, but like that was always part of it. Like we're doing vaccines and it's like, you say, hey, like we got muffins, we got Narcan. Oh, we also have the vaccine. Like if you want to talk about that, or like we have, other supplies people need to stay safe. And,
so you feel like that's kind of what's next for you, is going back toward overdose study and stuff like that?
Yeah. So I've talked with Ben about this, but I have a grant now that will get reviewed soon. That's like bringing together a bunch of agencies in LA to get a better sense of like where overdoses are happening. I mean, I know we know like, yes, like Skid Row hotspot, Venice hotspot, but a colleague of mine, David Goodman-Meza, who's an infectious disease doc at UCLA, we've been mapping out overdoses by type of drug over time in LA, like for fatal overdoses from the coroner, and seeing like a shift of like where hotspots are and where they're emerging. And it's like, oh, like, I live in the valley, so I'm always like, we don't get enough attention on overdose in the valley because it's a big problem. But like, you see like the hotspot for fentanyl is like shifting around between like Van Nuys and like West Valley, but then like there's this one in Long Beach that's kind of building up and down, and like the meth and cocaine centers are a little different. And so just knowing that, because I find a lot of, in my line of work, like people will just ask me like, oh, we're going to start a street medicine van. Where should we go? And the answer is not Skid Row because it's so serviced. But and so I can say like, oh, well, like depending on what you're doing, like I'd go here, but like that's not sustainable. So we're trying to make like more of a data driven thing to like kind of say like, okay, well, this is where like the hotspots for addiction like where you want to, if you want to do low barrier addiction treatment, this is where you go to meet people.
Right. All right. Man, a lot of interesting stuff coming, and we got a lot of interesting stuff out of this episode, Chelsea. Thank you. You were great. Is there anything that you want to plug or let our listeners know about?
I mean, you can follow me on Twitter if you want to see epidemiology tweets and the occasional hairless cat pic. Chelsea L. Shover, CHELSEALSHOVER.
All right. She does have a hairless cat. It's fucking really cool.
Really?
Yeah.
I'll
it's
take
rad.
your word for
Yeah.
it. They scare me. You guys can follow me at DannyGonzo34 on Instagram and Twitter.
Shout out to Peaches the cat, and you can follow me at Ben9Humor, Ben number 9 Humor, like benign tumor on Instagram and Twitter. Follow our show at PRC Pod on Instagram and Twitter, or at PRC Podcast on TikTok. Follow our sponsor,
CBD Living Water.
CBD Living Water.
At
We
CBD Living Water on
told
Instagram.
you all about it. Follow them, support them, tell them we sent you. Thank you guys very much.
See ya.